You're watching The Globe now. A team of doctors, nurses and specialists have given their time and their skill to the Robert Mangaliso Sobukwe Hospital in Kimberley in the Northern Cape. This to try and help alleviate a backlog of procedures and operations that have been delayed for some time. To tell us a bit more about this, we're now joined via Zoom by Gift of the Giver's founder, Dr. Imtiaz Sooliman. He joins us now on the line. Dr. Sooliman, thanks so much indeed for joining us. Give us a little sense of what your doctors, your nurses and your healthcare professionals found when they got to Robert Sobukwe Hospital.
Good evening, Peter. Our teams were called by the head of surgery at Dr. Ahmed Bayat at the hospital, saying that, they want to do catch-up surgery, but they have a shortage of anesthetists and scrub sisters. We put a team together of 10 people to assist them, and what they found was a team, a public service facility, very cooperative, keen to work, dedicated staff, surgeons, the hospital manager, the CEO, the nursing sisters, the floor sisters, the anesthetist sisters. Everybody was very willing to participate after hours, working the long hours, Friday, Saturday, and Sunday, in the interest of catching up surgery for patients who were waiting for a very long time. It was fantastic how the teams worked together and the joy of the patients, because many of them have been waiting months to have procedures done. And what each day you delay a procedure, the chances of debility, getting more complicated, getting more ill, it just rises with each day. And in this way, we also set a template where we can set an example to do similar procedures in other parts of the country.
All right, I was just about to ask, actually, what we're seeing in Kimberley, does that give us a clue about what might be happening in other towns and cities in the rest of the country?
Well, this is not something new. We've been doing it in different formats. In May, we started catch-up surgery in Fortescue Hospital, where the hospital itself selected a team which we're paying for. Then we're doing catch-up surgery every 2 weeks in East River, and that's cataract catch-up surgery. We funded the catch-up surgery in Burkhardt Hospital in August this year. Tomorrow, we're starting catch-up surgery in Helen Joseph Hospital, where we're funding neurosurgical procedures, especially the removal of tumors. The teams are there, the hospital, the theaters are available, but they require consumables and other items which we're funding. At the same time, we've already got requests from breast clinics after today's the weekend's events to come and assist there. So calls are coming from other parts of the country for similar initiatives. We are also engaging private hospital groups. We've done one private hospital group early in the year, 23 ENT cases. There's another group that wants to talk about another 100 cases, and other private groups have offered us the hospitals at no cost. So all these things are in the pipeline in terms of discussion, where we're trying to get a mass movement in the country where healthcare professionals, being specialists, whether in private and public hospitals and private hospitals, can come together to assist the country catch up. There's more than 200,000 operations that need to be done. And if we all start working together all over the provinces and people become available or offer their time, we can make a huge impact on healthcare, and especially those people who've been waiting patiently sometimes up to 5 or 6 years.
So this, I'll call it an operation in Kimberley. How long are your doctors and nurses going to be there for? And I would imagine as much as you can contribute, it's never going to be enough.
No, they're over. The procedures are what they were done today. Remember, these medical personnel are our doctors and nurses and healthcare workers in other facilities in the country. So it's a huge sacrifice. They finish off their own work, come for the weekend. They came Friday, Saturday, Sunday. They did very well, 72 procedures. And it means putting another team together when the surgeons are ready in the hospital for another catch-up case. A few months ago, or in September, we had something different. We had an outreach program in Tulsa Field. It wasn't surgical, but it had to do with optical care, audiology, general medicine, gynecology, physiotherapy, and a range of even dentists. We took in a whole team of 80 personnel. And early in the year, we took in 50 to the same town. So we're having various outreach programs to assist with health all the country. But the point is, it has to be short. It can't be too long because people have to go back to work. So we can send many more teams more often for a stint of 2 to 3 days, and they can make magic in that amount of time because they pull much longer hours in trying to bring healthcare to the people in the fastest way possible.
How has the health department taken to this idea?
Well, we've never had any obstacle. For example, in the Kotaska Hospital, you had to get the permission of the Western Cape Department. There was no problem. Because we do have a history with the health department. Since 2020, since the COVID, we've been very, very actively involved in health intervention throughout the country. We assisted 210 hospitals during COVID with various items. We were involved and are still involved right now with massive infrastructure upgrades at hospitals. As I'm talking to you, the last 2 weeks, we busy with a 50 million rand upgrade at Charlotte Macleay Hospital. And we've done upgrades in the Eastern Cape, in KZN, in Western Cape. So we've been very actively involved during the COVID itself and beyond. And then, of course, in the Eastern Cape, the other big challenge is many hospitals haven't had water. So we put balls in hospitals. We've put in dedicated oxygen facilities, beds, linen, oxygen machines, high video laryngoscopes, supplies. In some hospitals, even providing food for the patients when there was a problem. Then a hospital last week in Eastern Cape ran out of diesel because of load shedding. We made it available. So given all these activities, providing scrubs, over 12,000 sets of uniforms to different hospitals, we've built a fairly good relationship with the health departments, and they see our work is purely to augment, to take pressure off existing healthcare workers, to speed up delivery of cases, to bring health to the people much faster. So it's not an antagonistic approach or a negative approach or trying to show anybody up. We're there to support this department because we know there's a crisis in terms of consumables, in terms of resources, in terms of personnel, and we're all trying to do everything possible to help the people of our country.
What kind of skills are you finding are in short supply? Because we often hear stories of doctors who are finding it difficult to get jobs. Is it that general surgeons are plentiful supply, but specialists perhaps are the ones that are in short supply?
There's not a short supply of personnel. There's a short supply of posts.
Right.
That's a big problem. And there's another project we're looking at, and whoever's listening, and hearing, we're looking at promoting an idea of funding between 300 and 500 registrars. Now, registrars are those who study to eventually become specialists. The government has cut registrar posts, and there's far less registrars now in the public service than there were several years ago. But the patient count has multiplied exponentially. So you have many more patients and much less registrars. And this affects academic medicine. In other words, we can't teach junior interns, medical officers, and the other doctors in that category. And we will have very few specialists qualifying, which means we'll have compromised healthcare. We understand that the health department has a serious budgetary constraint, as do most government departments. So we're calling on private sector, let's start funding these registrars who will go on to qualify and become specialists. And at the same time, whilst doing that, they train students and junior doctors behind them. So we keep up the level of academic medicine and research and training. Each registrar costs between 1.1 and 1.2 million, which is not a lot of money for a corporate company. If we get 300 to 500 corporate companies coming to the party, we can make a huge impact in the health service in this country in multiple disciplines, have better teaching, better doctors qualified, and better patient care.
Dr. Sooliman, we'll have to leave it there, but thank you so much indeed for what your organization continues to do to help our people, health systems, and in other areas of need. Thank you so much indeed for your time.
It's a pleasure.
All right, that was the founder of Gift of the Givers, Dr. Imtiaz Sooliman, talking about how doctors, nurses and other health professionals have been deployed to Kimberley at Robert Mangaliso Hospital there to help with a backlog. And he says that this is a model that can be rolled out to many parts of the country, and private sector, public sector need to work together.